Cassie. Dr. Smith wants to send you home with a new medication. Have you heard of Lasix?
Yes, I have.
You have. You can feel free to interject with any questions. I can show you this handout a little bit that I'm going to go over some of the important information on Lasix. It's also known as the water pill. It's a diuretic, and you're going to have a lot of increased urination, so you're going to want to make sure to take it in the morning, every morning. And do you have any allergies or health conditions that we need to know about?
No.
No? Not that you're aware of at the moment. If you do, you can always call your doctor at any point. It's the point of the pill is to remove the excess fluid that your body's building up due to the heart failure, and it's going to reduce the swelling in your legs and keep the fluid balanced, like at an appropriate level throughout your whole body. You're going to want to take 40 milligrams. That's what we're prescribing you. It's one tablet in the morning, and it's going to be take it in the morning because I told you earlier the urination you're going to have increased. Take it with food if you do have an upset stomach. You don't have to take it with food, but if your stomach is upset, definitely take it with food. When you miss a dose, if it's not too close to the morning, like if you realize it at night, just wait until the morning. But if you miss a dose and you realize it in the afternoon, just take another one. Just take it as soon as you realize. You're going to want to make sure to monitor your blood pressure frequently. And if you have any questions with that, we can go over that with you too. The sort of effects of the medication, since it's a diuretic, you're going to want to weigh yourself every morning, and you're going to want to call the doctor if you increase a weight gain of 3 pounds. The symptoms of dehydration are very common, so you're going to want to kind of increase your water intake, and you're going to want to make sure that you're getting sufficient potassium as well, so like bananas, green leafy vegetables. And orthostatic hypertension is another common side effect. So when you're sleeping at night and you wake up suddenly and you feel dizzy, lightheaded, that's kind of what that is. It's just a change in the pressure in your body. So you're going to make sure that you change positions kind of slowly from like watching TV or something. The most common effects, there's like a long list of them, but the main important ones that you're going to want to report are going to be dehydration. So if your mouth is really, really dry or you're just extremely thirsty, stuff like that. If you're not really peeing a lot, or a headache, a pain in your like chest, your calves, or your lower abdominal area. If you notice a big drop in your blood pressure, that's another one you want to call in. And then gout is like tenderness or swelling in your joints. You're going to want to make sure to call in for that too. Do you have any questions so far?
No, I don't think so.
Okay. We'll also give you a handout so you can take home with you and call in if you have any questions. Based on medications, you're going to want to make sure you know exactly the medications that you're on, like over the counter and what you get at the pharmacy. And because it interacts with a lot, it's got a lot of complications with that. So just make sure that we know all the medications that you're on so we can point out if there's any problems that might occur. And when you're storing the medication, just keep it at room temperature, not too hot, not too cold. The moisture is a big thing. Don't keep it around water. And definitely out of light. And then if you have any kids around the house, you don't want to bring it around them. So you can look over this handout, and then I can get you more copies if you have any questions. Do you have any questions?
No, I think it's good. Thank you.
Okay. Yeah, no problem.